Welcome to the Center for Innovation in Campus Mental Health's Conversations Over Coffee video series. My name is Perlin, and I'm the Research and Knowledge Exchange Coordinator for the Center. And joining us here today is Dr. Kathy Short. Hi, Kathy. Thanks for coming in.
Oh, my pleasure. Thanks.
So Kathy is a clinical and child psychologist whose research and practice interests focus primarily on knowledge exchange, knowledge mobilization, and implementation practice. Very hardcore stuff. So today we're going to be talking about the K-12 system and mental health in the K-12 system. But not just that, we're also going to be thinking about the transition for students between K-12 and post-secondary education and what that means for mental health supports. So Kathy here is the Director of School Mental Health Assist, which is a provincial implementation support team designed to help Ontario school boards with mental health promotion for their students. So Kathy, School Mental Health Assist was first established in 2011, I believe,
That's right.
to help address gaps in organizational capacity for mental health programming. In those 6 years, it's a long time, in those 6 years, what are some of the key things that you've done? In 20 words or less. No, I'm just kidding.
6 years almost. I think what we were trying to do as a system in the K-12 was to move from what can be a rather fragmented patchwork of good programs and services into something a little bit more coherent, so that all of our 72 school districts have some guidance and direction about where to put their energy and how best to get evidence-based programs on the ground for students. And what we realized is that though there were many places we could start, we thought probably the best place to start is to set up some of those organizational conditions and to build capacity so that when programs came to light, they would be doing that on fertile soil. And so a lot of our work in the first 5 years has been to set those conditions. Part of our thinking on that was we'd done some research, both provincially and nationally, related to what some of the barriers were. So we really know what to do in school mental health K-12. The literature is really clear on that. But when we ask about what's actually happening in real life on the ground, it doesn't always match up with what we know works. And it's about what is that gap, the knowledge to practice gap, that makes it so hard. And in many ways, school systems aren't really set up for school mental health practice. So our job was to try to bridge that knowledge to practice gap and address the kinds of challenges that we heard about. So in the survey work we did nationally and provincially, we heard about three main kinds of challenges: systemic challenges, knowledge challenges, and implementation challenges. So the kinds of things that we've been doing in the last 5 years have been to address those sorts of things. So when it comes to systemic challenges, one of our pillars of work relates to what we have our top 10 organizational conditions that we're suggesting need to be in place at a school district level, but also at a school level. So an example of that would be on protocol development. So we wanted to make sure that every school board in the province had a suicide prevention, intervention, and postvention protocol, so that they are ready and poised if a student was to say that they were experiencing suicidal ideation, that whoever was chosen, whoever the student happened to turn to, would be ready and know what to do. And we're moving towards that aspirational goal, and I think most boards now have a protocol and are in process of being able to roll that out so that the staff widely would be aware of them and know what to do. The second pillar of work in the past 5 years has been on capacity building. So our thinking is that everybody in the school system needs a level of awareness. So whether you're a bus driver or an office administrator or someone working in central office.
Like a basic level of equipment.
Anyone, needs a basic level of awareness, because students don't discriminate. They choose the person who's caring and listening and not necessarily a positional role. But then there are those who work more closely with students who we think need a level of literacy, and so our work has been creating products for principals and teachers to help them to understand and be able to recognize signs and symptoms when students might be struggling, but also to teach about mental health, and this may be relevant for your audience. So those are two different things. Acquiring knowledge to be ready in case, and then acquiring knowledge to be able to actually take and teach to others. And so we're trying to provide some support there. And then the third area that we've worked on has to do with the selection and uptake of evidence-based programs. And the reality is that there's a lot of really good work out there, but there's also a lot that's untested. And in the area of mental health promotion, it's often seen as kind of a soft thing where you can't really do any harm, you can only just do good, and that's actually not true. And some of the work out there, some of the programs and services sound good, but then they don't have much evidence attached to them. So you're putting money and energy into something that you're not sure has reward. And some of them, frankly, are harmful. And so we're trying to help people to be discerning about that and provide some decision support. And we also have an area of work related to creating things that are both evidence-based and implementation sensitive. And I'm not sure if it's the same in your sector, but in the busy life of K-12 schools, it would be sometimes difficult to take a manualized evidence-based program and put it on the ground. And so, because it just doesn't fit into school classes, so we're trying to find ways to embed it in curriculum, and that might be something we come back to when we talk about transitions. Very quickly, the fourth pillar we work on is specific populations. So our work began with really understanding sort of general implementation, but then we said, well, there's some populations, because of the social determinants of health, and for other reasons, require more or different sorts of mental health supports. And so really paying attention, for example, to early years mental health, different strategies needed for students who are young, kindergarten, full-day kindergarten kids. For Indigenous mental health, different kinds of concerns, LGBTQ mental health, just different kinds of supports required potentially. And then fifth has to do with system coordination, which is a little bit what we're doing today, is really saying, schools have one role to play, but we're only one player in the big scheme of things. And if we want to get this right, we need to have more conversations like this and make sure that our bridging work is done well, because that's where we sometimes have gaps, is in collaborating across sectors. And
yes, it's like everyone is doing a great job in their own silos.
But how do we do it together so that kids can move from one system to another effectively?
So what would you say is the main thing that you've learned from supporting the province's 5,000 schools? Like it's a huge task.
It is, and I guess that's partly it, is to be thinking towards sustainability. So anything that we're doing, we're thinking about how would this scale and how would it be sustained? Because we do have 72 school districts. We have 117,000 teachers. So when we think about doing professional development, just by way of example, face-to-face meetings are never going to get you where you need to go to equip all teachers. So we have to be creative. So a lot of our work, although you like the Cadillac models, it's hard to be able to actually do those in practice over time. So we have to be thinking about how to do things that have reach and be sustainable. So I guess the main message is it's not just what you do, but how you do it. And we've been really focused on implementation science and trying to think with a long view. But there are challenges in that, because people want this done yesterday because there's urgency. Well, there is. Our kids are struggling, and it feels for some like we aren't moving fast enough, and I understand that as well.
So how do you deal with that?
What we try to do is be as responsive as we can to things as they emerge, and use the opportunities that come forward that are urgent to help us with the longer view. So a quick example would be when the newcomers from Syria came, and we were asked by our partners in the Ministry of Education to help to support the mental health needs in schools. And so that afforded a really nice opportunity to not only support these newcomers, but also to reinforce messages about welcoming and creating supportive environments and good for all students. And so we used that as a vehicle to then promote mental health for everybody, and also to point out what some signs are when students are struggling, not just for those with a refugee background, but for others who may also be struggling with trauma or other issues. So we look at opportunities like that to be able to build our knowledge base.
I see. Great. So we're going to just switch gears here a little bit and talk about transitions from K-12 to post-secondary. So after working in K-12 for so long, what do you think are some of the challenges that students graduating from high school face when they come out to either the real world or go on to further their education?
Well, I think that there are many. And I think students, one of them I would say falls in the area of expectations, that I think students leave secondary school feeling pretty confident they've achieved something, and they feel like they've got something to offer, and then they come to another setting and they realize that it's a big world out there.
And like everything is flipped on its head.
A little bit for some students, and I think for some that can be pretty challenging, because it takes a lot to get into a post-secondary institution, and they've achieved a lot, and then I think sometimes they're feeling disappointed that they aren't able to achieve at the same level with the wider pool of students. Or I think there are challenges socially for many kids as they're introduced to a new world, sometimes not living at home, and some of those challenges as well. So it's sort of that safety and comfort of the small pond.
Yeah, like
into
it's
the
a
big
sense
pond.
of dislocation, both like internally and actually externally.
I think it can be for some students. Most definitely.
So what do you think that these students need going into college and university? What are there some aspects of the transition that we need to be looking at closely?
When I think about the skills that help kids to move forward, actually, let me back up. The kinds of things that we're teaching around social emotional learning to students, and that's a big focus for us in K-12, have to do with skills, attitudes, knowledge, and habits. And so we want them, for example, to learn skills like problem solving and conflict resolution and sort of those things that are going to help you get through life. And of those category of skills, I tend to think the most important one, and the one that I think if we could only teach one thing to students as they're leaving and getting ready for their next phase, it would be around how to ask for help. And that might sound mundane, but it's actually something that generally people aren't that good at. We feel like we're independent and we can handle it all ourselves. But particularly in this area, when there is change, when there is transition, students, they feel lost and they don't necessarily know where to turn. So I think in terms of equipping students, being able to ask for help is effectively is a good and important skill to have. The second part of that is then we need to equip systems to be able to receive that request for help, so that people are ready to provide the help, and there's a low barrier access to service.
Yeah, I think this speaks to what you were saying earlier about everyone should have like a basic level of being equipped to handle these types of things. Yeah,
I think so. And the attitudes and habits that we're talking about would be, you know, what's your go-to coping skills? So, you know, for kids who have really sailed through secondary school and then they're coming up against a wall, I worry that they haven't got enough of a chance to experience hardship, academic hardship, I guess, until they get to university, and then they don't have the skills for coping. So that would be another category of skill that I would be hoping, you know, that students would be able to kind of hone in that transition time. So it might be practices related to contemplation or reflection or mindfulness, or it might be tapping into their spirituality, or it might be more in terms of exercise. But having some go-to coping places, it might be social, so that kids aren't left alone in their dorm rooms, just feeling isolated and like there's nowhere to turn.
Yeah, it sounds like a lot of it is about building resiliency early on.
It is, I think.
Yeah.
I think that's, you put it well.
Yeah. So there are kids who go through the entire K-12 system and then they sail through it, but they have mental health concerns.
Yes.
But then they get to college or university and then they drop out after a semester or two. What do you think is happening here? Is it the same problem of like that dislocation and...
I think it's probably unique to many students. I mean, we know that this is the time, the age span, where if you're going to have problems with depression and anxiety, they're most likely to emerge. So in this transitional age youth, so it's partly that. It's partly situational, so it might be any number of factors, risk factors could be coming into play, and a need for more protective factors. It probably is individual to students, and as you say, maybe a pre-existing predisposition towards a mental health problem.
Mm-hmm.
But there are still things we can do to help.
For sure. And it is like, as you mentioned before, it is kind of everyone needs to get on board with this. It's not just the schools are responsible for mental well-being. So in the Pathway Support Toolkit that you helped produce, it said that lead agencies were identified from the community and tasked with joint planning, priority setting, and they would reach out to school boards, the partners on the school boards, and bring them into conversations about community mental health.
Right.
Can you tell us a bit about how this was facilitated? Because that seems like a really fantastic idea.
Yeah, so this was the Ministry of Children and Youth Services, and they have they initiated a sort of system transformation where they identified, I think now 34 lead agencies across the province who have responsibility for community mental health plan and also for a core service plan that they each deliver. But part of the community planning is sort of stretching out on one hand to education and the other hand to their hospital partners and saying, okay, how can we work together to build a system of care? And in anticipation of those conversations, what you're referring to, the Pathway Support Toolkit, was something we developed with Ministry of Children and Youth Services, Ministry of Education, School Mental Health Assist, and the Ontario Centre of Excellence for Child and Youth Mental Health. So lead agencies and mental health leaders from school boards came together, and we really we're exploring. So what is it that school boards do particularly well? What are we positioned well to do in this system of care? And broadly, I think people would conclude primarily mental health promotion and prevention services are really what we do best and are best situated to do. So if that's the case, how do we do that? What is our ideal future for that so that we don't end up trying to do other things and there'd be duplication? So the toolkit just gives us a bit of a tool for reflection as school boards in terms of what we do well locally and what our partners do well, and then coming to some consensus about who is best positioned to do what. So it's a talking tool, really.
I see. So going back just a little bit to what you're saying about that tiered framework of like what the community provides and what the school provides, what do you think the school is reasonably expected to provide their students with?
In the K-12?
Yeah.
In terms of mental health?
Yes.
Okay. I think we do think in triangles and multi-tiered systems of support. So universal mental health promotion can occur every day in classrooms and actually does. It's just not always named as such and isn't always done as systematically and explicitly as hopefully in time it will be. So, those good, we have a model we call the AIM model, the Aligned and Integrated Model, where we have different sort of strands that the everyday teacher can do to support mental health in the classroom. So how they welcome students each day, how they include and engage students in leadership, how they partner with parents, their own mental health literacy and knowledge, and how they partner with community. All of these things can be part of that base. And then noticing when something might be not quite right and being able to identify the students that might need more, sort of a higher dose of skill development or supportive care in some ways, and making sure that those kids get the support that they need to, from, and through care. So I think that's really our role in schools. Many of our schools do have social workers and psychologists and psych associates, and we're very lucky in that sense. So we are able to do brief therapies in school, sort of cognitive behavior therapy, motivational interviewing, that sort of thing. And we're examining now some evidence-based implementation-sensitive preventive interventions for students at risk that are sort of a 4-session triage model that allow us to be, I think, a little bit more standardized about what kind of mental health services are offered in schools and the standards that would do that, so that we don't have as much of this sort of 20 to 30 sessions of supportive counseling, but are much more specific and targeted about where that resource goes, and that's something we're moving towards.
So I guess the school provides to a certain extent. Then what happens when a student escalates beyond the point of which the school can handle?
I mean, that's really when this community plan that we talked about comes into play. And in an ideal world, we have clear systems for which students that are having concerns, then there's a pathway within the school board. So that might begin with a sort of a conference at the school level with multidisciplinary team. Supports might be put into the regular classroom. And that might progress to, say, a psychological assessment or some other kind of intervention that happens within the school. Sometimes school boards have programs or services. Many use programs like Cool Kids or various types of programs that students might go to in a group setting. And then, if needed, we use community partners, so we would reach out and make sure that there's a warm handoff to community agency. I mean, that's in an ideal setting. Sometimes this all happens very quickly and there's a crisis, and then it's a different scenario, but it's still, again, those protocols need to be really clear so that there's no sort of wondering what to do. It needs to be pretty concise.
Yeah, and it often happens that the student, just because the student escalates beyond the point of which the school can support, and they go out, they get outsourced in the community, doesn't mean that they won't come back.
No, they will come back.
Exactly.
And so that becomes really, really important. The coming back is critical, and we know that particularly in cases of more extreme mental health problems where there's been suicidal behavior. This really importance about post-hospitalization or post-ER visit, and what we do with those students who are at risk, and that safety planning is something that's, the evidence would tell us, is pretty critical part of the picture.
Yeah, so what do you think is needed for the school and community to work together such that for the student it's as smooth as possible, coming in and out, going to school, coming out of school, and then going back to school after that point?
Well, I think it comes down to collaboration and communication amongst the professionals so that the students don't have to experience any bumps in that. It should just be seamless for them.
Yeah.
It's hard enough. I mean, if you're thinking about what the student themselves is going through, but also their family. They're coming to you as a professional probably at their worst. They're distraught, they're upset. This is the most difficult time of their lives when their child is struggling with something emotional. And we're asking them to do things that are hard, like talk to 14 different people and tell their story. And that's not right. We need to make sure it's as simple as possible for people when they're at their most vulnerable.
Yeah.
So I think all we can do as professionals to make it a good experience for them, to make the student feel cared for, and reassure the parents that people are all working on the same sorts of things is really important.
It's like a circle of care.
Circle of care. Very much so.
So if a student has a complex mental health concern and then they graduate from high school, what happens in the intervening months between graduating high school and starting university and college? Is the student still supported by their high school or the community?
That's a great
What happens
question.
there?
I think if they're connected to community, most definitely. I'm thinking if I was a therapist in the community, that would be a time when I would be knowing that I'd be having some ramping up work to do to make sure that the student felt prepared, and I'd be working on coping skills and that kind of thing, and would be working quite closely with them. If a student is not connected, then no, because the school services typically don't happen over the summer.
Yeah.
So that leaves a big gap. I've heard of some innovations across some university and school board connections, which sound really exciting. Some summer programming where, and you probably know about those, and that
Like
to me
bridging
sound
programs,
bridging programs that sound really important, and I think really important for not just students who have identified mental health problems, because as you said earlier, sometimes those problems don't emerge until they're in the post-secondary setting. And so it would be nice if
we could have a
wish list. One of those things might include perhaps a companion approach to the orientation types of things that already happen on campus that allow for some more of the skill development. And I know some of that is there, but it won't be the necessarily first thing kids go to in an orientation week.
Yeah. There's the frosh, and then there's the
there's a lot of
drinking, and then I
competing
think
things.
everything else just falls by the wayside.
Well, it does, and I think that drinking is a whole other thing that we may or may not want to talk about today. But I think it is an issue for many kids for whom this is the first experience that they've had. Although there's a perception that for many it's a usual thing.
Like it's a rite of passage almost.
I suppose,
Yeah.
but it can be dangerous for some.
For sure.
One of the points I would make, and you may agree or disagree, is one of the barriers, I think, to transition is some of the difference in legislation across K-12 to post-secondary in terms of parent involvement and family involvement. And from what I understand, there are some concerns when families of often students who aren't even 18 yet are not really allowed or invited into conversation around supports. And I think that can be a real challenge for kids with mental health problems when their parents are told that they can't participate in some of the conversations about support.
No, that's very
And
true.
I think
That's
it leaves families feeling worried about their kids who are already vulnerable, and when they're not being able to be told things, that can be very problematic in some cases.
Yeah, it enhances the social isolation that students
does.
feeling, and then it escalates the rest of their problems. So
Right, and
you're right.
families who are feeling already vulnerable are being told, no, you don't have a role anymore, they're adults, when they're not in some cases.
There are existing programs, as we mentioned earlier, there are existing programs like Pathways to Education that provide like mentoring and support for students. Are these actually integrated into the school curriculum though? Like how does that happen?
There is integration into the school curriculum. So in 2011 with the Open Minds, Healthy Minds, there were revisions and amendments to all curriculum in Ontario. So what they call the front matter of every curriculum, whether it's social science or history, now has a mental health expectation component. And then the health and phys ed curriculum was revised in many ways, but there was also, in addition to some of the ones you might have seen and heard about, there were a lot of changes around mental health. And so throughout the curriculum now there are expectations related to skill development and mental health literacy for students. So that's a significant part. But in addition to that, one of the things we've been exploring is how to embed social emotional learning, so that skill development piece, right into lesson plans of every day in classrooms. And we've got a couple of projects on the go. One is in grade 10, and it's part of our civics and careers, and that's a course that every student in the province currently has to take. And we've got a 9-lesson course that teaches things like mindfulness and coping with stress and asking for help, that kind of thing. And we just finished an evaluation of that, and it's been quite well received, where students are actually doing those skills in class. And I think increasingly that's the way to go, because as an extra it's hard, but if you're embedding it into
in
course,
the curriculum itself,
it's helpful.
So who teaches this? Is it like regular school teachers or okay?
It is, and the way we've set it up, we do web-based training so that there were 9 lessons, so the first 3 lessons we would do a web-based training on, and our mental health leaders. So every school board has a mental health leader, a clinician with responsibility for their strategy. And they sat alongside the teachers as coaches, so as they then delivered the first 3 lessons, they could refer back to their coach, their mental health leader coach. And then we had another web-based training. This is because it's provincial, so we have teachers from all over the province. And then in their own board, when they delivered the next 3 again, they could consult with their coach. So that model seems to be working, because we know that this is tough material for teachers. It's not part of their usual training, and so they're learning, and then they're teaching their students. But they really appreciated having someone that could say, no, I'm worried when a student's asking a question about this. So it's that sort of iterative learning together seems to be working.
This is slightly off topic, but for the teachers who are learning the material and teaching that material, would you think that it helps them with their own mental health concerns as well? Because mental health for faculty is also something that we've been thinking about.
It really is. That's such an important question. We decided really from the onset that we couldn't address student mental health literacy without being attentive to staff mental health, mental health and well-being. And so in all of our work, we include personal resiliency facets, so that teachers are attending to their own self-care and modeling it in their classroom. We often don't put that oxygen mask on first as busy professionals, but it actually is something we should be doing, not even for ourselves only, but for the people that we're serving, so that we're better, and that so we're modeling it for them. So that is a really critical part, and we have found that when teachers are delivering these programs to students, they will tell us, hey, I used this skill or that skill because it applies to all of us.
That's fantastic. Okay, last question, but it's a little bit of a tough one.
Okay.
So in thinking about system-wide transformation and coordination in the post-secondary education sector, how do you think the work that School Mental Health Assist has done would be relevant to post-secondary education?
I think the biggest lessons that we've come through are really about how to approach something as big as what we're all trying to do in our various sectors and together. And I think having a bit of a systematic, coordinated approach across settings can be really helpful. And when you have that and you pair that with a community of practice approach, then it's a co-learning together, but it's done in sort of systematic, coordinated ways. That's served us well, so that we're all roughly moving in the same direction, but we have these feedback loops that are built in. So we might suggest to the province schools a particular direction, and then they will tell us how it's playing out on the ground through the networks that we've developed. And I think that just makes us all better, because it's not like it's top down. It can't be just top down. It has to be group. So I think, any time that we've been creating resources, we co-create them with the people who will be ultimately receiving them. So if residents, Don, say we're a group that you were trying to build resources from, you'd bring them to the table right at the beginning and create them together, and then you try them out and you hear from them about what worked and what didn't. That approach has been, I think, a helpful piece. So
it's an
maybe that would
iterative
help.
process.
It is.
Yeah.
And very collaborative.
Well, that was a fascinating discussion on coordinating mental health supports between K-12 and post-secondary education. Thank you so much, Kathy, for joining us today. If you'd like to see more of this, subscribe to our newsletter by going onto our website, campusmentalhealth.ca, and leaving your email address on the top right corner of the front page. And if you're interested in more resources, ideas, news surrounding post-secondary education and mental health, please go to our website, because there's lots of that there. Thanks for watching.
Thank you.